Have you ever felt like you've been deceived when you bought something? Maybe the price was 3 times more than you thought it should be, or it didn't do what you thought it was supposed to do? Well, seniors all over the great US of A are finding this to be the case on their Medicare prescription drug coverage, and things need to change. We're going to talk about that next. Hi everyone, this is Rick McDermott, and thanks for joining us. I'm here to talk to you about how things need to change with Medicare Part D. For everyone in the US that's on Medicare, you have the option to sign up for a prescription drug insurance. And we've been helping people since 1995 with retirement, Medicare planning, long-term care planning, and it's our mission. We love helping people. As a matter of fact, I just spent about an hour trying to help someone sign up online for Medicare. And if it's hard for me, sometimes it is. The government's websites are wacky at times. You can imagine how hard it is for everyone else. So we're here to help, and we'll take as long as it takes to help anyone that needs help. So I was back in Washington, D.C. at the beginning of March, and we were at the NABIP conference, National Association of Benefits and Insurance Professionals, where I paid to go back and represent you to help make sure your Medicare benefits are maintained. One of our talking points to our Congress people was people on Medicare Advantage, the alternative to Medicare, have 3 extra months to change their plan. Or people that are on just plain regular Medicare have from October 15th through December 7th about 6 or 7 weeks to change their drug plan. That needs to change. It's not fair, and I'm going to go to our website right now and explain a little bit more. So people that are on regular Medicare have 2 options. You can have Medicare driving the bus, and you can have an insurance company and a standalone Part D drug plan. Now, the insurance companies would rather you have Medicare Advantage, so you're going to get lots of advertisements in the mail, all kinds of deceiving things pop up on your phone. Yesterday I was on a news site, and this site said free groceries. Everyone on Medicare can apply to get free groceries. And it's a very, very, very deceptive ad because only a very small percentage of people can get groceries on their Medicare Advantage plan. But that's the hook. So I clicked on the link and it said this unbelievable benefit that you can get. So if you read the fine print, it says this is an ad for Medicare Advantage. A lot of these places only want you on Medicare Advantage. So people on Medicare Advantage get 3 extra months to decide if they're on the right plan or not. So if you went to a car lot and bought a car and got a warranty and the car breaks, and then you find out that the warranty didn't do what you thought it would do, and you ended up having to fork out the whole cost to repair your car, that's what we're finding with people on Medicare Part D. Case in point, we had some clients on a prescription drug plan through Cigna, and they went to a Kroger pharmacy, Fred Meyer Pharmacy here locally, went to fill their prescription drugs, and the pharmacist said, you have to pay the whole cost of your drug. And it was several $100s. So here we are in January of 2023, and they can't get their prescription filled unless they paid the whole cost out of pocket. If the same person in January was on a Medicare Advantage plan, the replacement to Medicare, the substitute bus driver, not regular Medicare, the insurance plans by law can be changed to a different Medicare Advantage plan up until March 31st. So when the rubber meets the road, by law, your drug plan in September must send you an annual notice of change letter. If you fail to read the letter, or you toss it aside with all the rest of your junk mail, you don't realize that your premium may go up 4 times. It might go from $20 a month to $80 a month. We've seen this happen. One plan went from $24.90 to $92 a month a couple years ago. And we had a number of our clients call us saying in January or February, help, I need to change my drug plan because my premium went up 4 times. And we have to say, well, we sent you our letter and our emails reminding you to review your drug plan, review your annual notice of change letter that by law the insurance company must send you. You didn't read that letter. We can't herd all the cats. We're here for you, but you need to pick up the phone or email us and get a hold of us so we can review your drug plan. Had they been on a Medicare Advantage plan, they could change their Advantage plan in January for February 1st. In February, they could change their Medicare Advantage plan for March 1st. In March, you can change your Medicare Advantage plan for April 1st, either to a different Medicare Advantage plan, or you can get off of Medicare Advantage and go back to regular Medicare. And if it's been less than 1 year and you had a Medicare supplement plan at your very first time, you can go back to your Medicare supplement policy. No health questions asked. So there's Medicare supplement plans and Medicare Part D standalone. You only have until December 7th to change your plan, but everyone on Medicare Advantage can change it up until March 31st. It's not fair. We were back in DC telling our congresspeople this. Contact your congressman or your senator and say this must change. They need to hear your voice. The more people that reach out to their congresspeople, the better chance this has of changing. It's not fair when you go to your pharmacy and your pharmacy's out of network, or your prescription, instead of being a tier 1, is now a tier 3 or a tier 4. Even though the Medicare Plan Finder said it was tier 1, it can be wrong. So there are often mistakes on the Medicare drug plan lookup tool on Medicare.gov versus what the actual price of the drug is when you get it refilled January, February, or March of the following year. There's nothing you can do about it. You're stuck on that Part D drug plan for the remainder of the year. So now you have to call your doctor, try to get him to change to a similar drug, or if your pharmacy's out of network, go to a different pharmacy. So if your favorite pharmacist no longer accepts your insurance, and this happens every year, drug plans can change a drug formulary during the first couple months of the year, or if the drug manufacturer deems a drug is now unsafe, or if there is now a generic version available, they can take that drug right off your list. So all we're asking Congress and CMS is to make it a level playing field for everyone. People should not be penalized because they're on regular traditional Medicare with a standalone drug plan. Many people don't want Medicare Advantage. They want Medicare to be their primary payer. They don't want an insurance company requiring prior authorizations or having to deal with networks and co-pays. That's great. There's many people that love Medicare Advantage. That's great too. But shouldn't people have a level playing field to play with? Let your congressman know that this needs to change. We need an open enrollment period for Part D, just like there is for Medicare Advantage. If you have any more comments about this, please comment below. And if you haven't subscribed yet, please subscribe. We're here to hear your voice. We're here to represent you as well. But we are one voice. We need all of us to band together on this issue. Thanks so much and have a great rest of your day.